Hello friends, we will be discussing something about diabetes today. Some basic things, as this disease is rapidly increasing all over the world. India is said to be the capital of this disease, and most of the population is being affected by this disease. So some basic things about diabetes we will discuss. What is diabetes? We know body requires glucose as a source of energy for carrying out various activities in the body. This level of glucose in the blood is maintained by a hormone called insulin. When this insulin is deficient or is not acting properly, blood sugar are not controlled and blood sugars rises. This condition is called diabetes. Okay, there are various types of diabetes. Like three basic types of diabetes is type 1 diabetes, type 2 diabetes and diabetes in pregnancy, gestational diabetes. Type 1 diabetes is a condition in which there is absolute deficiency of insulin, as pancreas is not producing insulin at all. In that case, blood sugars are not controlled. This type is seen basically in children and in adolescents. This is also called juvenile diabetes. Okay, these patients requires lifelong treatment of insulin to maintain their blood glucose levels. Other, which is most commonly seen, which is 90% of the cases which is seen, is type 2 diabetes. In this case, there is insulin deficiency or the insulin is not acting properly, which can be managed by tablets, insulin, or various means like exercise, Another third type is gestational diabetes. Diabetes diagnosed during first time pregnancy because of hormonal changes, it is called gestational diabetes. Okay, which can continue in very few cases and which disappears after delivery also. Okay. But these patients are at higher risk of developing diabetes in future. Okay. So what are the signs and symptoms of diabetes? Diabetes, most commonly there are no signs and symptoms. Sometimes patient goes to the lab with friends or before pre-operative checkup, they came to know that they are having diabetes. But there are a lot of common signs and symptoms also, like easy fatigability, increased thirst, increased frequency of urination, wounds those are not healing, genital infections. These are the common side effects, blurring of vision. These things can happen in diabetes. Who are at risk for developing diabetes? If there is family history of diabetes, increasing age, as we know that as age advances, there is more and more chances of developing diabetes. Above 40 years, diabetes is very common. But because of lifestyle and all factors, the age of diabetes is coming down. We can see diabetes from type 2 diabetes from 20 to 25 years onwards also. Even in childhood we can see type 2 diabetes because of obesity and lack of exercise. Risk factors for developing diabetes are overweight, lack of exercise, physical inactivity is very major problem. Healthy food habits is also a very common thing, like more of increased saturated fats, more of carbohydrates, lack of fibers in diet. These are common faulty food habits which can lead to diabetes. Okay. Another is gestational diabetes, because gestational diabetes patients are at higher risk of developing diabetes in future. Okay. Other thing is like how to diagnose diabetes. What is the criteria for diagnosing diabetes? There are three criteria, like fasting blood sugar more than or equal to 126 milligram per deciliter, OGTT, oral glucose tolerance test, in which the glucose, particular amount of glucose is given, and after 2 hours if the blood sugar is more than 200, we can label it as diabetes. Or HbA1c more than 6.5 is diagnostic of diabetes. Okay. When we check fasting blood sugar level, we should at least be fasting for 8 hours, overnight fasting, and then only we can check as a fasting blood sugar level. Can diabetes be prevented? we can prevent or prolong diabetes by following certain steps to maintain proper body weight, physical activity, at least 30 to 40 minutes of brisk walking or various types of exercises, sports, proper actively involving in sports will also help in increasing insulin sensitivity and in preventing or prolonging diabetes. Proper food habits, more of fibers in the diet, less of saturated fats, more of complex carbohydrates like whole grains. This will help in preventing diabetes. Again, use of tobacco and tobacco products should be restricted. Alcohol should be kept in moderation. Can diabetes be cured? Unfortunately not. Right now we can only treat and control it, but right now we cannot cure it. Patient has to take lifelong medications. Patient should not change their medicine on their will. Once sugar gets controlled, many patients stop their medicine. This should not happen. Whatever changes you want to make, you should consult your doctor first, and with doctor's advice only you should make changes in your medicines. And you should take medicines, patient should take medicines on proper time, whatever time, like the tablets in the morning should be taken in the morning, and before dinner should be taken before dinner, and proper care should be taken before while taking medicine. Does the diet for a patient of diabetes should be different from those of other family members? Definitely not. Patients of diabetes can have the same food which other family members are having, but the healthy food practices should be followed by everyone. Okay, more of complex carbohydrates, less of fats, and more of sprouts that should be there in the diet, and there should be a small frequent meal pattern should be followed by diabetic patients, so that portion size should be reduced and patient can have frequent meals, but one quantity of but small portion meal size at various times. How to manage diabetes? Like there are, you should keep your you should take your medicines properly. Proper diet should be followed. Proper exercise regimen should be followed. Regular checkup should occur. Screening for complications of diabetes, like for retinal checkup, kidney checkup, cholesterol checkup, should be followed as per advice by doctor. There is ABC should be under control. ABC is like A1C, HbA1c, which gives average of last 2 to 3 months, that should be under control. B is blood pressure. Blood pressure is also equally important, that should be under control. C is cholesterol. Cholesterol is also very important. That also, this ABC control will help us in preventing lot of complications of diabetes. Can diabetic patients fast? Not, definitely. There should not be prolonged fasting in diabetes. But if you cannot avoid fasting, you first, before fasting, should consult your doctor, change your medicine accordingly. In between, you should check your blood sugars regularly. If there is sudden rise in blood sugar level or drop in blood sugar level, you should immediately terminate the fast and have proper advice, have proper thing done that particular time. Complications of diabetes be prevented. Yes, you should have proper good control of blood sugar level, BP control, cholesterol control, proper physical activity, proper diet, regular checkup. All these things will help in preventing complications. Mental stress should be very less. Proper sleep is very important. There should not be addictions of tobacco. So these all will help us in preventing complications of diabetes. Some few basic things about diabetes. Thank you for patient listening.